Sorry. So, thank you. So we're beginning to talk about the um, you know, different type of pneumonia. If you get infected in the community, you develop pneumonia, 80 or 90% of the time it is streptococcus pneumonia. If you get in an infection in a hospital called nosocomial and you develop pneumonia, it's not streptococcus, but it's more of MRSA. Recently, we've seen more. And this is methicillin-resistant Staphylococcus aureus, right? Sometimes it's Pseudomonas. We began to talk about how there are pneumonia that might causes typically primary atypical pneumonia. And this is due to microorganism that is not culturable, like the mycoplasma, for example. Um, and then we'll talk about, is the pneumonia developed in the alveolus, right? Or between the alveoli. If it's between the alveoli, we call that interstitial pneumonia. And so the primary atypical pneumonia that typically mycoplasma is the one that we see pneumonia in between the alveolus, the interstitial. Okay, the streptococcus or the staph, they didn't tend to develop more of the alveolar type of pneumonia. Okay, now the alveolar types of pneumonia, it could be, so let's say here's the right lungs and here's the left lung. It could be um, this is known as the bronchopulmonary segment, or only one bronchopulmonary segment is affected, right? Whereas the lobular is the whole lung that are affected, or the whole lobes. Okay? So that's what we mean by alveolar type of pneumonia. Okay. Interstitial pneumonia, where I talk about the atypical one, often associated with primary atypical pneumonia, mycoplasma, nice small organism. So here, the interstitial is in the septa, atypical. In the alveolar, this is more bacteria, bronchopulmonary, which is patchy or lobe, the whole lobe, right? This whole lobe is the one that is streptococcus. Okay. Or the bronchopulmonary could be streptococcus, but most likely, in the case of nosocomial, is MRSA, for example. Okay. I hope you make the distinction. Alveolar in the alveolus that you can see here. Okay. Yes, so this is considered alveolar type, acute pneumonia. In this case, it's lobar. It's streptococcus pneumoniae. For broncho, MRSA, for example. Okay. You can have MRSA, or sometimes you have Pseudomonas. Some virus can cause this as well. Okay. But definitely lobar is most likely is your community acquired. Your strep is this type of pneumonia. Okay. What is the question here? So broncho is nosocomial, acquire lobar community. Yeah, you can. I wouldn't just go there. In the case of you can community acquire influenza, right? Flu, for example. And in that case, that community acquire can develop bronchopulmonary, bronchopneumonia as well. So it's not just this ideas that a community is more lobar and a nosocomial is bronchopulmonary. Because an example is community could be influenza, but you can develop bronchopulmonary. I would rather say that this is the most important. The low bar is your typical community, which is your typical streptococcus pneumonia. All the other one is this, right? So it could be virus, could be um, um, influenza, it could be staphylococcus, MRSA, right? Actually, staph you can get not only in hospital, but you can get it in the bathroom as well. My student is testing for staphylococcus, and you can see in the environment some of them are MRSA. Yeah, so you can get it in the outside community as well. Okay, and the other thing is, yeah, so like a lot of fungal infection. By the way, fungal infection can also get these bronchial patches. Okay. Other things, we already know that people that develop immunosuppressed can get deep mycosis. Uh, okay, Cryptococcus neoformans often sees as immunocompromised individual like CMV virus Canada. Okay. Oh yeah, so this is also patches as well. Deep mycosis, alveolar, right? The only interstitial one that it doesn't say it, but the interstitial, make sure you know interstitial is atypical pneumonia, which is unculturable organism like mycoplasma. So I will use that. Lung cancer, I'm not going to talk about too much other than that there are two types. There's small cell carcinoma and non-small cell carcinoma. In that non-small cell carcinoma is divided into adenocarcinoma and squamous cell carcinoma. Okay, the um, the the smoker that usually get is that, why don't we just say, for smoker, it's very common that they get this one, squamous cell carcinoma for smoker. Okay. And they don't get this adenocarcinoma very much, but usually it's this one. This is important also, I want you to know as well, that for small cell carcinoma versus non-small cell carcinoma, the people who have small cell carcinoma, their 5-year survival rate is dismal. Okay? Um, if it's limited, in this case, you can see here is that in the small cell carcinoma, if it's limited, then 20% of them survive. But if it's spread, then it will be less than 1%. In the case of non-small cell carcinoma, the adenocarcinoma is the most common non-small cell carcinoma, and depends on the stages of the the spreading, if you will. Staging is always think of staging is tumor size with the TNM, right? Remember that? Staging is tumor size, node, positive or not, and metastatic TMN, if you will. That's physiological. That's staging. If it's goes to the node or not, if it's node and metastasis, that's what we call different stages. Stage 1, pretty curable, 60%. It's pretty good. So in terms of lung cancer, the most common carcinoma that is associated with smoking is the squamous cell carcinoma. It's non-small cell, and their survival, their prognosis is very good. Small cell carcinoma is very very dismal. And most important thing is that the adenocarcinoma, the glandular type, is the most common non-small cell carcinoma. Okay, and you do that, and actually non-smoker do develop this adenocarcinoma. Okay. Okay. Alrighty. It's small cell carcinoma, very small. Can't really tell much from that. Large cell carcinoma, much larger relative to this. This is more of, it may have some neurological features in these large cell carcinoma. So just some more terms where pneumothorax is collapsed lung, effusion is where you get fluid, right, in accumulation, inflammations of the pleural membrane called pleuritis, hydrothorax, which is basically fluid in the lung. This one from a hemothorax, means whole blood. Mesothelioma, cancers of the plasma of the pleural membrane, and that's often associated with, I would say this associated with asbestosis. Okay, again, asbestosis. Okay, I think that's the conclusion of the respiratory. Do you have any question? Disorder? Okay, take a couple minute break. I'm going to load in the blood disorder.